17 bosses that I have to listen to every month. But this person I'm going to introduce is the boss of my boss. So it's the second layer of my boss. We came here and then we were trying to seek assistance with how do we underwrite the cost of our lab. And we're looking into partners that will be able to assist us. So the vice chair of the board, John Henkel, Dr. Gilbert Lawintor, who sits on our board over there, and more importantly, Henkel, who sits on our board, saying that could we approach the clinic and see they will partner with us because they're doing this thing for free clinic. Why couldn't they extend their help to us when we're doling about $120,000 to Quest Diagnostics every month for our lab services? So Kate said, let me see what I could do. And then Dr. Lawintor said, let me see what I could do. John Henkel said, let me see what I could do. And they all did it. So they introduced me to this gentleman. They said, Pudge, let's go speak with Pudge. Pudge. I mean, after I'm a Pudge, in my mind, I construe going to look for a Pudgy-looking man. I mean, Pudge. Okay. Then they took me to Cleveland Clinic, and I met this distinguished man. So humble, so warm, and listening to all this about care lines, I'm spinning left and right. So he said, what would you like me to do? I said, I would like you to help us with our lab cost. And so I said that I'll call you back. He did call me back, and I'm proud to say that the Cleveland Clinic underwrite all the cost of our lab for us. We don't pay a single penny to Quest. Everything is processed. We meet with them monthly. Not only is the financial side, but also the quality side. Dr. Brown, Dr. Harris, they're able to order tests that helps the patient. And so we felt it's so important to recognize such a person at the annual meeting. Now let me read a brief about what he's done, where he's been. Very, very impressive background. Oliver Henkel, nicknamed Pudge, is currently the Chief Government Relations Officer at Cleveland Clinic. Before he joined Cleveland Clinic, though, he was a partner for Thompson Hines LLP law firm for years, 87206. He was a VP Vice President for Progressive Corporation. Also, for a long time, he really serves longevity wherever he went. But more importantly, he served as the National Campaign Manager for the presidential campaign of Gary Hart. Some of you might not remember Gary Hart, but Pudge was the one who was the National Campaign Manager. Pudge graduated his undergrad and his law degree from Yale University. One of the things that he's done in the community, really, he was very active in other areas, but more importantly, he was the founding chairman of the Playhouse Square, which is just our neighbor, not far from where St. Clair is. But most recently, he's been appointed by Governor Strickland to the Ohio Health Coverage and Quality Council, which is really crafting recommendations for healthcare reform in Ohio. What better person can you get to be on the side to help an organization to move forward? But personally, what I've enjoyed is that every 3 months, Pudge have time for me. We meet at the Intercontinental Hotel for breakfast, guide me what is coming down the pike, how could he assist, and what my other peers are doing. And that's some personal enrichment I'm getting from Mr. Henkel. So at this point, Pudge, if you could join us at the podium, please.
I'm mindful of the time constraints, Francis, but I am very flattered to receive this award. But I really receive it on behalf of the Cleveland Clinic and Gil Lowenthal and Kate Nagel and others who are actively engaged with Care Alliance, because we very actively believe in collaboration with various organizations in the Cleveland area, and we have worked with Family Neighborhoods Practice with Gene Therian and with Neon and with Care Alliance. And I had the opportunity last week to give a keynote address at the YMCA's annual meeting, and my theme was on collaboration. And so much of what we are going to be able to do, that is all of us in this community, in providing quality healthcare service to all of those who deserve to have access to quality health care, is to work together to try to achieve it, because there is not one organization by itself that can do it. We have to work together, and the federal government is now providing new avenues for all of us to find ways in which we can collaborate so that we can deliver to everyone in the United States, and specifically for all of us in Cuyahoga County, quality health service on a very efficient basis. One of the ways we have most recently collaborated with both Neighborhood Family Practice and with Care Alliance and with Dion is in what we call the CHAP program. It's Cuyahoga Health Access Partnership. A 501c3 organization was created, and I'm happy to say that all of the healthcare stakeholders in Cuyahoga County have come together to develop a means to deliver access to healthcare for the uninsured in this community. And one of the principal objectives will be to identify medical homes, and we are looking with greatest focus at the community health centers as providing the medical home for all of the people who now are having trouble gaining access. And so to all of you, I pay great compliments for the service that you're providing to this community to make healthcare a reality for everyone. And thanks so much. I appreciate it.